Hi, it's me, David. I would like to welcome you back to Life with Parkinson's. Thank you for taking the time to watch. Over the last few years, I've been somewhat surprised and amazed by the long list of symptoms that Parkinson's disease can produce. I'm not going to go into any speech on advising how often someone should see their dentist, and of course, I always suggest if you have any concerns, you seek out medical professional advice. But for me personally, going to the dentist isn't a simple endeavor. I have to try to schedule it when I'm not off. I don't have dyskinesia, dystonia, or bad anxiety. When I think about it, there really aren't that many times in the day that are good for me to see the dentist. And on top of that, I'm not really cool with having a needle put into my mouth. Does anyone else here have a fear of needles? I do, so you know what I'm talking about. Sitting there in that chair getting drilled and filled is not a simple thing to do. My first problems with my teeth started in 2006 when I got a little bit of PTSD from falling off the ladder at work. I would relive the event over and over and over again in my mind while I was sleeping, and I would wake myself up multiple times in the middle of the night smashing my jaw shut. It was very painful, but thankfully it didn't last very long. My dentist at the time was upset at me for not letting him know what was going on because he was very proud of my teeth. I grew up in a town full of perfect teeth due to the fact that at the time they added fluoride to the city water, and my dentist was very proud of that. It upset him that something bad was happening to my teeth, but when I think about this time, it was definitely a prelude to having Parkinson's disease. A few years after getting over the ladder incident and the PTSD that came with it, the jaw slamming and the bad dreams began to resurface. But these were new dreams, violent dreams, and someone was always coming after me with a gun. It was very peculiar, and we tried to think of anything that could explain it. Stress, exhaustion, lack of sleep, nothing seemed to fit. I woke myself up in the middle of the night slamming my jaw shut so many times that eventually I cracked a tooth. It didn't break off till a few months later, and when it did, I was far away from civilization, so I was very fortunate that none of the nerve was exposed. My new dentist, at the time I had switched to a different office, just out of convenience, wanted to drill and fill it. But I was like, no, I have a bad fear of needles, please don't. So she tried to fill it without drilling, but it failed the next day, so I had to go back and get it drilled and filled. My poor anxiety. When I was young, the dentist was easy to go to. There were always smiling, happy people there to greet you, eager to get you into their chair and clean your teeth. And plus you got to pick the bubblegum fluoride treatment at the end. And then on the way out, a toothbrush and a prize that always turned out to be dental floss. But somewhere along the way, I had a traumatic incident with needles that apparently scarred me for life and made going to the dentist a new form of torture that I really don't enjoy. One winter, when I was about 10 years old, I was shoveling snow off the back deck with my two sisters, and I walked behind one of them just as she was throwing the snow over her shoulder without looking, and the shovel hit me, thankfully, in the nose. It was right about, actually you probably can't see the scar anymore, but it was right about there. And it scarred me for life in two ways. One, it was a good way to identify me, and two, the event was very traumatic because when I got to the hospital, they held me down on the bed to give me the stitches, and I was screaming pretty badly. And so now, every time I have a needle, that memory comes cascading back, and I just can't seem to get over it. The only thing that seems to calm me down is to tell the story to the poor person who has to listen to it and who is giving me the needle. That's basically what drove me so hard to preserve my teeth. I would brush 2 to 3 times a day, floss once or twice, and mouthwash at least 3 times because I would do anything to avoid getting a needle, especially in my mouth. Shortly after the mouth smashing began again, I went for a regular checkup and I was shocked to discover that I had a cavity. I hadn't had one in so long, and despite my regular hygiene, one had gotten through. I couldn't explain, nor could the dentist give a valid reason for it, and I still hadn't been diagnosed with Parkinson's, so it was a mystery. Sugar in my coffee was the only thing that I could come up with. Unfortunately, my perfect teeth hadn't lasted forever. I wish that fluoride was still in the water, but could it stop cavities with Parkinson's? That was the question. The dental problems seemed to carry on, and I had a new cavity every time I went back to see the dentist. Boy, they were making some good money off of me. And to help solve this mouth smashing issue, they had this fancy mouth guard to wear at night that I get to put in every time I fall asleep. And it's really easy to wear and isn't a pain at all, and doesn't interfere with your sleep in the tiniest bit. After I was diagnosed with Parkinson's disease, the dentist suggested that I needed to take even better care of my teeth and advised me to come to see her every 4 months instead of 6. Good advice or good salesmanship? Does anyone here enjoy trying to floss or brush your teeth when they're off? I certainly don't. But here, I've got my dental floss here, and I'm purposely doing it when I'm off right now. So you can see how hard it is to try and get the floss around your fingers, and then you get to put it into your mouth. Anyhow, you get the idea. It's been recommended that I switch over to a water-pick toothbrush. It's something that I'm looking into, and it's on my wish list. But if anyone in the dental world is listening, what I really need is some sort of device that I can put into my mouth that kills off all the plaque and destroys it with like a sonar pulse or something, and then eliminates all the bacteria with like UV lighting, and then releases a fluoride treatment into my teeth that lasts forever and gives me those perfect teeth that I grew up with. Brushing and flossing will become obsolete, and all the people in the Parkinson's world will give off a giant sigh of relief and think about all the money that could be made with such a device. If you've made it this far, then I thank you for listening to my story. As you know, I'm often amazed by the amount of varied symptoms that Parkinson's disease can produce, and dental ones is definitely in my top 5. Maybe that would make a good video. Anyhow, what did you think about my invention? Do you like it, or do you have a better idea? Let me know in the comments below. Also, if you would like to share your dental experience, I would be happy to hear about it. I'll see you later, and I hope we can take this journey together. Goodbye and have a good day.